name is Michelle Miller. I'm currently a paralegal at Miller Law. As the name suggests, my husband is Randall Miller, the attorney at Miller Law. Prior to moving here for the past 13 years, before that I worked in the healthcare industry. I managed large-scale dental practices, both corporately and privately, handling multi-million dollars in accounts and insurance billing. I did consulting in Las Vegas to streamline front office for billing, customer service, and insurance issues. I believe that I can help on the hospital board, and it's more of a community service, an opportunity to serve the community, simply because I've been on both sides of it. I've been the patient, I've been management, and I've been the employee. And I think we have a large chasm between our public and what's happening within the hospital. My goal would be to bridge that gap and hopefully be able to create some kind of cohesiveness or programs or systems to help bridge that. I think that some of our focuses are off that we have in the hospital. Some of the ways that we're spending our funds are misused. I think that there's a significant room for growth, and that I can be an integral part of that. One of the most important experiences that I have as far as budgeting is the last practice that I moved to 10 years ago. I was hired privately by a doctor out of a large corporate company to help build up a practice that had gone bankrupt. We purchased it out of bankruptcy, and we built it up from a $250,000 a year practice to a $3.1 million practice. I was strategic in the management of the growth, making sure that it was sustained growth, that the town, we lived in a very small town, could both sustain, and that we were still being affordable and available to the patients in our community. I believe that it's a mixed bag, to be perfectly honest with you. I think some of the directions the hospital board is going are great. I think there are some things we have that are set to come to our community that are needed and overdue. But I believe that there's a significant number of things that could be redirected. I think that there could be more investment in the staff, in training, in different programs here for our community. I think it's a real mixed bag, and that as much as good, change is also needed.